Good evening and welcome. I'm Harold Holzer, and I have the honor of serving as the Jonathan Fanton Director of Roosevelt House. You'll meet Jonathan Fanton himself soon. On behalf of Hunter College President Ann Kirshner, who is overseas, I want to welcome you to one of the true highlights of our year, every year, here at Roosevelt House, and that's the Joan H. Tisch Community Health Prize. It's amazing to think of it, but this is the 11th Tisch Health Prize event. I've been proud to be here for 8 of them, and through pandemics and transitions, health crises conquered by health heroes, through all of that, we have persevered and we are back again. Thanks above all to the determination and generosity of Lori Tisch. So welcome back, Lori, and thank you for everything you do. We always point out, especially for the benefit of our honorees and their guests who may be visiting here for the first time, that this is the perfect spot to hold this ceremony. And that's because this house was the New York City home of Franklin and Eleanor Roosevelt for the 25 years before they left for the White House in March of 1933. Needless to say, a great deal happened here, including the New Deal, but also campaigns for governor and president. 81 years ago, the Roosevelt family sold the building to Hunter College. I would like to say they gave it to Hunter College, but they sold it at a very deep discount to Hunter College. And Eleanor Roosevelt herself handed us the deed at a ceremony on main campus. Everyone here apparently expected Franklin Roosevelt, but he was on a battleship en route to the Tehran Summit Conference, where his ship was actually attacked by an American torpedo accidentally. And FDR, if you think he was a timid man, said to his steward, "Wheel me to the starboard side so I can see the torpedo." And it just missed the ship. It was just fired accidentally by a submarine. More to the point, quoting the president that day, Eleanor reminded everyone at Hunter to look on all human beings with respect. And we have tried to make that our goal at Roosevelt House. During the years, this building served as a student center for clubs and organizations, and in the years since its restoration and reopening as a public policy institute. Then and now dedicated to the Roosevelt legacy of public service, public policy, and human rights. And among those rights, as FDR said in one of his last fireside chats, by the way, his first fireside chat was staged upstairs on the second floor of this building. One of those rights was the right of every American to good and affordable health care. He didn't live long enough to make that dream a reality. It was, as we know, Truman tried to make the dream a reality. But he did obviously achieve other tremendous social innovations, most of which were hatched here at Roosevelt House during the transition, because this was also the transition headquarters for the incoming Roosevelt administration after the election of 1932. One small room, about a quarter the size of this auditorium, was where the administration to come knit together the building blocks of the New Deal, including Social Security, which was first discussed upstairs on the second floor. And as we all know as well, or should, this house was also the scene of one of the great personal health stories of the early 20th century, because this is where Roosevelt made his inspiring recovery from a disease that left most of its victims paralyzed and out of view. FDR not only determined to exercise here every day in that same room that became a transition headquarters, but to practice using braces, etc. So it was in this house also, with Eleanor's great support, that FDR fought back against polio. Probably because, unlike Hyde Park, this building had elevators. And if you remember pictures of FDR, rare pictures of him in his wheelchair, it didn't have arms. And that's because his armless chair with wheels, handmade, specially made, fit perfectly into the elevator. When you go up for the reception, have a look at the William Vanden Heuvel elevator, which is the original that FDR used up until 1932. Also, he helped establish the March of Dimes Foundation, still one of the most transformational health achievements in American history. And in the first Social Security Act, FDR made sure that not only was old age assistance introduced, but also aid to dependent children and the visually impaired. So that's a bit of the Roosevelt and building history that animates our day-to-day lives here at Roosevelt House, and also particularly makes the Tisch Prize ceremony here that much more special, especially when it's linked to the legacy of another great New York hero, Joan Tisch, for whom the prize is named. And you will hear more about the great Joan Tisch and her own pioneering work as a health hero from Lori in a few minutes, because Lori embodies the spirit, and thanks to her, this prize now 11 times has recognized and advanced the Roosevelt tradition of health innovation and community care. Lori and the Tisch family have made sure this prize is a generous one, awards that truly make a tangible difference to those who have earned them, to their organizations, and to the overall health of New Yorkers. And this year, in recognition of the challenges faced by this year's class of honorees, who kept entire communities together during the pandemic, and who now address the surge of new arrivals in need of care and attention and advice, this year's prizes are particularly generous. So we thank Lori doubly for that. And others to thank are Roosevelt House Advisory Board champion Rick Lufglass of the Lori Tisch Illumination Fund for his support and his advice and his inspiration. We're honored to welcome back to Roosevelt House Dr. Mitchell Katz, the head of New York Health and Hospitals, the great and inspiring CEO. Our provost, Manoj Pardesani, is here. It's special as well, of course, to have the honorees together with their friends, families, and colleagues to share the moment, and members of the jury who worked very hard to achieve consensus this year. So let me thank them, above all to its chair, the founding director of Roosevelt House, Dr. Jonathan Fanton, who you will hear from in a moment. Jury members, Dr. Steffi Wohlhandler, who is a distinguished professor at the School of Public Health. She's not here. She's in Cambridge, but that's understandable. Sue Kaplan, research professor in the Department of Population Health at NYU and a member of the Roosevelt House Advisory Board. Anne Marie Morrow, the Joan Grabe Dean of the Hunter School of Nursing, who is here, and a special welcome to the great Joan Grabe herself, who is here with Bill. Joan is a great Hunter benefactor in her own right. Hunter High School, Hunter College, can I say the year? Because it's so great. Hunter College, class of 1960. Longtime Hunter College Foundation board member and recipient of an honorary Doctor of Humane Letters in this very room. Joan, thank you for yet another turn on the Tisch jury. Thank you for everything, and welcome back. Another thank you to a truly legendary figure among health heroes in New York. She couldn't be here tonight, but I just want to do a special shout out to Dr. Lillian Barrios Paoli for all she did to work with the jury this year and to bring us to this moment. So tonight we're going to honor two individual award winners about whom you will learn more when jury members read their citations, but we're honored to welcome them here, Dr. Ted Long, Helen Ortega Landaverde, and Lorena Carusias, all of whom have done great work. Before we hand them their honors and ask them to speak, please let me call to the podium our dear friend and inspiring partner. I've said it before, without whose devotion to this moment we would not be here. We're so proud that you continue to support this. And so let me introduce you to a New Yorker, whom I would describe, as we've often described her, even if she didn't own a special team, I would introduce her as a true New York giant. Lori Tisch.
Thank you so much, Harold, and good evening, everyone. The other day, I got an award from the Anti-Defamation League, and I don't usually talk about my own health, and I don't usually repeat other people's jokes, but after more than 50 years of doing sports, I mentioned that I had just gotten a cortisone shot that day, and after hearing the kind introduction then and your kind introduction today, I said it reminded me of the old, I think it was Henny Youngman joke. I don't really deserve that kind introduction, but I don't deserve arthritis either. So, so thank you. Thank you also. Please give my thanks to President Kirshner. I know that she's not here, and again to the entire Hunter staff. And especially the people who reviewed. I know that there were many, many, many great candidates. I always look forward to this event because we celebrate such great individuals and organizations whose contributions have truly significantly advanced community health and well-being. And as Harold said, this prize reflects my mother's lifelong commitment to public health and her belief in the power of individuals and organizations to make a difference. So some of you here know about my mother's story, but I'll review it. So in the early, I guess it was in the early 80s when not many people knew about AIDS, my mother was a bit of a diva. She had many gay friends. And they were getting sick and they were losing their lives, and there was not a name for this disease, but a friend of hers told her about the gay men's health crisis. So she went pretty much undercover and she said, hello, my name is Joan and I'd like to be of service. And this was, I don't know, 1983, 1984, and nobody really knew very much about her. And then the fax machine broke. If you're too young to know what a fax please keep it to yourself. So she said, well, I could actually buy a new fax machine. And they said, well, how do we know the check isn't going to bounce? And she said, no, it's all right. The check won't bounce. So she wrote a check for, I don't know, $250, and she bought a new fax machine, and her name was on the check, and they asked her to step forward, and they said that she could do much more good if she stepped forward and used her voice as quite a prominent New Yorker, which she did for years and years and years. And she hadn't always been an activist, but she, and some of you may remember Judy Peabody, were the first kind of for society women, for a lack of a better word, who really got involved with AIDS, hands-on, and many, many people followed them. As a matter of fact, when my daughter was in law school, she went to Gay Men's Health Crisis and said, my name is Emily and I'd like to be of service. And she ended up with her own client who was gay, obviously, and was an immigrant and couldn't go back to their own country. I think it was somewhere in Central America. I don't know if she ever saved the client, but she worked very hard. So, for that reason, my mother had not just a great influence on me as a young parent, not now, 40 years ago, but also a tremendous influence on both of my daughters. So, as Harold said, this year we honor two extraordinary individuals whose work, like my mother's, has touched countless lives and strengthened so many communities. And it's especially gratifying to me this year that our leaders are some of our leaders are at New York City Health and Hospitals, which is one of the signature partners of the Arts and Health Initiative of my foundation, the Lori M. Tisch Illumination Fund. And again, a shout out to Drs. Mitch Katz and Drs. Eric Way, who Rick and I and my staff, who is here, Emmeline and Kira, maybe? And Kira, work so closely with. We had one of the projects, we did many with health and hospitals, but one of them was to build 26 murals. It started with 26 in every single New York City public hospital and long-term teaching facility and long-term nursing facility. And it went all through COVID. We didn't miss a beat. And health and hospitals staff was tremendous to work with, led by Eric. And as they say, no good deed goes unpunished. So our thank you was to ask us to do 10 more murals. And we've done, I guess, about 20 or 10 more murals, and we've done about half of them so far. And we'll do more. So actually just last week I was at Metropolitan Hospital, and I was helping to paint a community mural. Just fill in the blanks. I want you to know I support a lot of artists. I am not one. So I was filling in the blanks. And these murals are collaborations between artists, patients, and staff, and the surrounding community. And there's so many good things that come out of these murals, including the great beauty that is left behind at the hospitals, but it's also the process, and the process helps address staff burnout, compassion fatigue. It bolsters pride in the system, breaks down barriers. At one of the murals that we were painting, there were 3 or 4 armed police, I guess hospital police, painting, and right next to them was, I think, the head of HR. And every table had a group like that of doctors, of patients, of community workers. So this support has helped to create, as I said, 36 murals throughout the system at every hospital, long-term care facility, and in dozens of community health centers. And this is just one of the actually many arts programs being offered by the Arts and Medicine Department at health and hospitals, and have really, in the 10 years that we've been doing them, become a vital part of the healthcare system, and we are immensely proud to support them. And as Mitch and Eric and many of you know, many of the private hospitals and better funded hospitals have these arts programs. I don't think they're quite as good as these actually, but they do have arts programs. But we wanted to do something for the public hospitals, and you all took it and ran with it, and we love partnering with you. And now about our honorees. Our first individual honoree is Dr. Helen Arteaga Landaverde, CEO of New York City Health and Hospitals at Elmhurst. She's dedicated her career to serving some of the most vulnerable populations in our city. And as most of you remember, Elmhurst was really ground zero during COVID, and did a tremendous job. We actually have one mural there and another coming. Not yet. I guess not yet is the answer. But I did paint there, yes. And we're also doing other programs with Elmhurst. Helen's advocacy for equitable health care has inspired not only health outcomes for thousands, but also inspired a new generation of healthcare professionals. First woman of color and the first Latina to lead the hospital's executive team, felicitaciones. And under Helen's leadership, New York City Health and Hospitals Elmhurst has been recognized as one of U.S. News and World Report's best regional hospitals and one of the nation's highest performing hospitals. Helen and her team at Elmhurst ensure that every person has access to the health care they need and deserve. So congratulations. Our second individual honoree is Dr. Theodore Ted Long, and he's been a beacon of hope and driving force in our public healthcare system. Dr. Long's visionary leadership and relentless dedication have been instrumental in addressing some of the most pressing health issues of our time. At New York City Health and Hospitals, Dr. Long leads operations for the Humanitarian Emergency Response and Relief Centers. Whoa, is that all on your card? For asylum seekers coming into New York, as well as the citywide Arrival Center, which is called Gotham, the Division of Health and Hospitals, one of the largest federally qualified health centers in the country. Dr. Long is responsible for transforming Gotham's current portfolio of ambulatory care with more than 5 million visits per year. I'm going to say that again, more than 5 million outpatient visits per year. That's really something. Into an integrated and high quality network providing care for all New Yorkers without exception. He oversees population health and supervises the New York City Care Program, which again provides universal access to care for all of New Yorkers. His commitment to excellence and his compassionate care have made a lasting impact on the lives of thousands of New Yorkers, embodying the very spirit of this prize. And I think Health and Hospitals services 1 out of 6 New Yorkers. Is that right? 1.6 million New Yorkers. So, again, congratulations. That's really something. Doctors Artiega and Landaverde and Long will each receive a $10,000 prize, which they have both designated to support the vital community work at New York City Health and Hospitals. And these contributions are a testament to their unwavering dedication and the extremely positive effect that they've had on their communities. This year, we're also thrilled to present the organizational prize to Mixteca, a community service center located in Sunset Park, Brooklyn. Mixteca has been a lifelong for the immigrant community and provides essential services, education, and support for those in need. Their comprehensive approach to community health and their unwavering commitment to social justice has set a new standard for community service. So Mixteca is it Mixteca or Mixteca? Mixteca. Mixteca will receive a $20,000 cash award, which is the largest ever given in the history of this prize. This award recognizes the transformative impact of their work and our deep appreciation for their extraordinary efforts. So as we celebrate these exceptional honorees, we're reminded of the importance of the community and the power of collective action. The work of Helen, Ted, and Mixteca inspires us all to strive for a future where quality health care is accessible to everyone, no matter their zip code. So in closing, I want to extend my heartfelt congratulations to the 2024 Joan H. Tisch Community Health Prize winners. Your dedication, passion, and tireless efforts are so very inspiring for us all. So thank you for your remarkable contributions to our community and so clearly embodying the values of this prize. And now it's my very great honor to introduce Jonathan Fanton, a distinguished leader whose dedication to social justice, education, and community health is such a great example to all of us. Jonathan's impressive journey includes president of MacArthur Foundation, where he championed initiatives to address critical global issues, and then as president of the New School, where he fostered an environment of intellectual curiosity and social responsibility. His leadership at the American Academy of Arts and Sciences and his role as interim director of Roosevelt House further highlight his dedication to promoting dialogue and action on pressing and current societal changes. Throughout his career, Jonathan has been a steadfast advocate for equity, human rights, and community well-being. His work has inspired so many of us, and his contributions have had a lasting impact on communities truly around the world. So please join me in welcoming Jonathan Fanton, who will present tonight's individual honorees.
Well, thank you, Lori, for that lovely introduction. And for your really inspiring remarks, and really set the tone for this great evening. Our first individual awardee is Helen Artiega Landaverde. We honor her for her work as CEO of New York City's Health and Hospitals, Elmhurst. She embodies the mission of public health system to deliver equitable health care to all New Yorkers, exemplifying the values of compassion, integrity, and respect for all. She has guided the institution's recovery as it navigates its post-pandemic future by expanding access to care, launching new specialty services, and widening the hospital's role in addressing social determinants of health. With deep admiration for her leadership, Hunter is proud to honor Helen Artiega Landaverde for distinguished accomplishments in urban public health. And Helen, if you'd come forward.
Well, thank you so much, by the way. Thank you for my Beyonce moment. I was like, wow, I look good. And then my mom was like, you didn't comb your hair. But I really want to thank everyone that's here today. This is such a huge honor for me. I'm a crier, so everybody already knows this. But in reality, you're not only honoring me, you're honoring my community, advocates that I have here that I have been fighting this war with me. Jeff, Assemblyman Jeff Aubrey, who was mistaken by my husband, actually. But he's been my spiritual dad, and actually the first day I started being the CEO at Elmer's, February 8th, in 2021, Jeff walked in and he was like, your dad is not here, but I'm here. So I'm forever grateful for that. And then I guess my woman a woman always has her tribe. So my tribe is here, Catalina Cruz, our assemblywoman, and again, Assemblywoman Jessica Rojas, and Francisca Moya, who's probably late in traffic somewhere. And of course, I couldn't hang out with a better man than Donovan Richards, who's also at an event for the Pride event. So he should be coming in later, but I really wanted to honor them here because they're my tribe. And when you think about a tribe and what makes that tribe happen, it's usually a catalyst. And that catalyst for me is my Elmer's team who's here. So I really want to acknowledge them. This catalyst not only sparks fires, they spark movements. And when you're dealing with a team of 6,000 with 1 million visits every year, that I have to tell you, when people doubted Elmer's Hospital when the pandemic hit, they should have thought twice. So I really, yes, because Elmer's is always there to answer the call for everything from COVID to healthy babies to a knee hip replacement or a knee replacement. But more importantly, Elmer's Hospital is always there, and I couldn't ask for a better team. And just when I couldn't think of getting any luckier, I get the proud honor of working for an amazing man where I get to learn every day from, and he makes me a better leader, a better mom, a better person in my community, and that's working with Dr. Mitch Katz. And Doc doesn't make it easy for me. He usually makes me sweat, but usually in that sweating, I have another group of people that catch me when he's like, Helen, you're sweating too much, let me help you. And that's my fellow CEOs. If my fellow CEOs are here, can you please stand? Because without you, I couldn't be doing this job either. So thank you so much. And of course, I came out of someone's belly. So in that coming out of belly and honoring mothers, of course, I need to honor my mother. Which, now you know where I get my confidence from. Ms. Titch, I don't know if you remember when you came to Elmer's and we were doing an artwork project with you and your team. I asked you, it's like, why do you dedicate so much time to the arts? And you literally looked at me and you said, because the arts have impact. And when I thought of tonight and I said about this amazing award, I was like, how do I give my gratitude, my thank you to you and my impact? And when I saw you when I saw you, you were like, oh, you look so pretty. And it's because I wanted to wear art. I wanted to show the impact you've had only in me, but in my hospital. So I decided to wear art. I don't dress like this at all. And like in this artwork, you see a plant. And in that plant, like in Elmhurst and in my community, we're growing. We need a little bit of sun. We need a little bit more soil. But one thing is for sure, is that with people like you and organizations like us and leadership from Dr. Katz and the amazing people in this room, I'm almost positive we're going to grow very strong. Thank you so much for this honor.
Well, thank you, Helen. That's a really uplifting and deeply moving remarks. So we thank you. I do want to echo Harold Holzer's thanks to our jury. We had a number of very, very strong nominations, and so it wasn't easy to pick, but I think we did pick the best three. And I want to thank two staff members, Bianca Olivia and Peter Scalafani, whose staff support was really essential to an efficient process and a wonderful outcome. I don't know whether, are they here? Yeah, in any case, we thank you very much. Our next individual honoree is sort of being introduced already. I can feel the excitement rising. We honor Dr. Theodore Long for his work as Senior Vice President of Ambulatory Care and Population Health at New York City Health and Hospitals. As former Executive Director of the NYC Test and Treat Corps, his work provided accessible, no-cost COVID-19 testing and supported patients with quarantine and isolation resources. His supervision of New York City care programs helps provide universal access to care for all New Yorkers. Additionally, he leads operations for the Humanitarian Emergency Response and Relief Centers for asylum seekers coming into New York, as well as a citywide arrival center. For his visionary leadership and dedication to improving the care of the most vulnerable New Yorkers, Hunter College is proud to recognize Dr. Theodore Long for distinguished accomplishments in urban public health.
Well, just in full disclosure, it is my children. They're the very well-behaved and excited audience members there. So I wanted to say a couple of things tonight about what I first felt when I got the call from Harold about the award from Lori and the jury here. The first thought that came to my mind is, with the right mission and the right team, and I'm joined by so much of my team here tonight, anything is possible. So I hope you'll humor me. I'm gonna walk around a little bit. Everybody can hear me, right? So when we need you there because we're recording. Okay. I can move around a little bit here. When I exactly, let's try to vibrate. Well, I want to talk a little bit about what the last 6.5 years have meant to me and to Mitch at New York City Health and Hospitals. And all I ask of you in return is, when I name my various team members, if they could raise their hand, and I could just do a quick round of applause for them, because they deserve the award today much more than I do. So that's my daughter running away. So I'll take you back to 6.5 years ago when Mitch Katz called me and said, "Do you want to come to New York City Health and Hospitals? We have one of the biggest deficits known to mankind, and and we're losing patients every year. Why not?" At first I did say no, but Mitch is a very convincing guy, and we got to yes. And the first thing was an underdog story. We had a federally qualified health center, Gotham Health, but like the rest of New York City Health and Hospitals, we were losing patients every year, losing tens of millions of dollars every year. But we made a series of changes, and the first person I hired, maybe the best decision I ever made, is Michelle Lewis right there. Michelle, you're supposed to raise your hand. And we were able to make a series of scheduling changes. For the system, we cut down our wait times by 50%. Instead of losing patients every year, we started to gain patients every year, and now Gotham Health is prospering. As we were doing that, I worked with Dr. Nicola Davis over here. So you didn't know I was going to do this. Where we have the most sophisticated population health system in the country, in my mind. So Nicola. Not only did we reverse the trend and offer people the care that they needed and deserved, but we recently found out that one of our clinics just happens to be the clinic where I'm a primary care doctor on Fridays, but using Nicola's data has the best high blood pressure control in all of New York State. Despite me being there. And then we started to see things going in the right direction at H&H, and Mitch called me again, and we decided to do another thing, which is how can we, now that we have created this access, we've hired the right people, go ahead and be the universal access point for all New Yorkers. So we started a universal healthcare program called NYC Care, and we have the director here, Dr. Jimenez. And through this program, I remember, just in a word, my first patient for NYC Care that I saw in my primary care practice in the Bronx, a woman that hadn't seen a doctor in 43 years, never had a mammogram, never had a pap smear, didn't know if she had diabetes. At the end, I asked why today was the day where she came out for care, and she started crying and said she didn't feel that she deserved care before that day. So NYC Care has now done that experience I had 140,000 times. 140,000 people. So that was pretty good, and I figured I'd start minding my own business. But then we all got the phone call about COVID, right? COVID hit New York City and hit us harder than anywhere else. But one of the things that I found is my inspiration throughout COVID was Chris, Sarah, and Annika right there. Chris Keeley, Sarah Joseph Kurian, and Annika Ginsberg. Literally leapt into action, and we formed the New York City Test and Trace, now then Test and Treat Corps, where we did, and here's some statistics that just are overwhelming. We did performed and gave out hundreds of millions of tests for New Yorkers. We did millions of vaccines. We have opened the country's first 24/7 vaccine sites. We even paid you to get vaccinated from the comfort of your home. We'd bring a team to your home and give you $100. As a result of all of that, with our help in New York City, 99% of New York City adults, 99%, got at least one dose of the vaccine. But that wasn't it. We also formed the largest contact tracing team probably in the history of humankind. We talked to 1/3 of all New Yorkers, and the brains of this is not standing up here. She's right there, Kathleen Blaney. But then we realized we had other issues too. New Yorkers were telling us when we called them that, and my patients told me this, that it was a false choice. I'm telling you to stay home, you have COVID or you've been exposed, but they had to work in order to keep their apartment, support their families. So then in New York City, with Dr. Amanda Johnson, we formed a unique program which was just from what New Yorkers told us they wanted and needed to keep their city safe, to keep their community safe. We were able to pay them, if they didn't qualify for paid sick leave, to stay home and do the right thing, so it wasn't a false choice anymore. We also delivered, 2.2 million meals, started a hotel program to support New Yorkers to also make the decision to stay home. And then New York City, we really were able to weather the storm together. We'll never forget the COVID days, but we got through it. And I think, if anything, I think of Test and Trace as the way we listened to New Yorkers and gave them what they needed to make the decision to support their communities, which is what they wanted. But that wasn't it. COVID was fortunately, we were starting to recover as a city together. was minding my own business. I was driving to clinic, and then again, I get a call from Dr. Mitch Katz. And this time he says, don't worry, Ted, not just a small thing. We have a dramatic increase in the number of people seeking asylum coming to our city every day. Maybe we could open a tent, maybe Central Park, something like that, temporarily. I knew when Mitch used the word temporarily that there was no such thing as temporary. We were going to be all in, and Health and Hospitals going to rise to the occasion to be what New York City needed us to be. So as soon as my next phone call was then to Chris, who was at a coffee shop, which he probably spilled his coffee all over himself. And Chris, Sarah, and Annika, one more round of applause. We leapt into action for New York City, and just to give you a sense of what we've accomplished in New York City, when I think about the impact of having all of the asylum seekers that have come to our city, we opened an arrival center where in other cities people have had to sleep outside, on the streets, haven't been screened for disease, have never seen a doctor before. Every day we see people like pregnant women that have never seen a doctor before they're 9 months pregnant. We see kids that have had seizures because their medications are taken away from them. We saw two doctors that brought their daughter to avoid the female genital mutilation that the mother, a doctor herself, had gone through. 150,000 stories, 150,000 people that will never forget their day at the New York City Arrival Center. That's what I want people to take away from what New York City's response has been to the asylum seeker crisis as we think about immigration going forward, is these are 150,000 lives we've saved that will make our city better and stronger going forward. So please, round of applause. And throughout all of this, too, I want to give a shout out to a couple more team members who I see in the back there. I don't see Adam, but I'm pretty sure I saw Adam at one. There's Adam. Laura Atlas, who is my head of Intergov, who is the shield that we needed to be able to drive the ball forward and to be able to do all of this work. You don't want to mess with Laura Atlas. And Adam Schreier, who's my press secretary, who's the hardest job in the world when he gets to read all of the horrible things that many people want to say about us, but he knows that his job is to protect us so that we can keep going forward and we can tell people the real story of what we've done in New York City, which I am very proud of. For Adam. And one final thank you I want to say here, and I'll start off with her many titles. Associate Professor at Yale University in Orthopedic Surgery, Associate Program Director at Yale. Sorry, I get teared up too. And the love of my life, Andrea. This is behind the scenes. My team knows me as a calm, cool, collected guy that nothing can, but that this is the reason why. She sees all the, she sees the real deal every day. She's my moral compass, and she is responsible for everything I've done. And finally, I'll conclude by saying, in the positive announcements, but I'm promised Harold I wouldn't move away from here. As part of our ongoing response to the asylum seeker crisis in New York City, which I've grown to care very deeply about, I would like to announce that I will be donating, you donated, I will be directing your donation of money to create the inaugural Roosevelt Children's Library at the Arrival Center. And with that, I'm sure I've doubled the time I was given, so thank you, and thank you for putting up with my kids, Dave and Zoe.
Wow, this has been extraordinary. And just a special repeat thank you to the elected officials who are here. As someone who worked in both city and state government, I know how difficult it is for your schedules to join, but your presence speaks volumes about the accomplishments of our individual honorees. And now to present the final prize of the evening, the organizational prize, let me again recognize and call forward Dean Anne-Marie Morrow.
Thank you, Harold. What an honor to be here this evening and witness the work of such extraordinary people and their teams. I mean, let's give them another round of applause. This was my first year on the jury. Thank you to Jonathan and Harold and my colleagues for allowing me to be here. And what an honor to announce the last award of the evening to the wonderful organizational winner. Tonight we honor Mixteca for its tireless support of the Sunset Park community. Mixteca addresses critical needs in health, education, social and legal issues facing the burgeoning Mexican and Latin American immigrant community in Brooklyn. As the only Spanish-speaking organization in the borough dedicated to providing these key services to asylum seekers, Mixteca's staff and volunteers provide linguistically and culturally specific support in Spanish and 4 indigenous languages. Especially since 2023, Mixteca has mobilized to meet the overwhelming demand for resources, serving at the forefront of support for thousands of newly arrived asylum seekers from across Latin America and ensuring that undocumented immigrants and newly arrived immigrants know their rights and gain access to essential resources. Hunter College is proud to honor Mixteca for distinguished accomplishment in urban public health. Accepting the award on behalf of Mixteca is one of Hunter College's own alumna from the School of Social Work, its executive director, Lorena Kurosias. Please, Lorena, come up.
So thank you so much. I prepared a speech, but I forgot my glasses. So you gotta deal with me. I think I can do it. I can do it. And also, I'm not really good on following my speeches because there are many things that I wanted to say. And first of all, I wanted to say that I'm here and I'm honored to be leading 100% immigrant woman-led organization in Sunset Park. That it can be said really easy, but it's not easy to do it. Immigrant people faces a lot of challenges, and being part of this organization with my team is not easy. And I'm so glad that Helen and they were the criers here, because I am too. And so you set the floor for that one. And so before I start saying something about the work that Mixteca does in Sunset Park and other places of the city, I want you to know the people that is behind this work. And this all the line, if you can please stand up, Mixteca team. And Megan, please. And Diana, please. Megan, stand up. And Diana. And so this is part of the team of Mixteca. Mixteca was founded 24 years ago from a concerned community members. They were really concerned that there were some people from Mexico with HIV. And I'm glad this is connecting. The circle is closing here, because they found a lot of people with HIV positive from Mexico, and not only in Mexico, but in Sunset Park as well. And they didn't know what to do. They didn't know, because the hospitals were trying to address these issues in the community, but they couldn't find a way to connect with the community. So these people, Dr. Rincon, and along with other people, were really developing a program to address the issues, the belief, the misconception, and especially the language that wasn't really addressed the way that the community needed. So they start creating this program, and all this work addressing the health in the HIV at that time with our community was really helpful with when COVID hits. So we knew what to do there. So we knew that our community will respond better if we build bridges between their resources available and their beliefs. So we create tacos, tortas, and testing to get people to get tested, because all the programs that you mentioned were also, Mixteca was working with all of them. Test and trace, we are so proud of NYC Care as well, because it's providing services to the community that otherwise have no places to go and to receive health, basic health, and to address some of the concerns that they have. So Tacos, Tortas, and Testing was a really cool program that we offer tacos and tortas if you get tested, when nobody wants to get tested. They were like, no, I don't have COVID, I don't want to get tested. But we knew how important it was. And with the support of health and hospitals, we were able that our people get tested. And then it was the vaccine available, but not for everyone. It was available for some people, and people that have challenges accessing the technology were not able to make an appointments. So all that team that you see here, I mean, Diana is here, and Laura, and Anna, and Ale, among all the others, but they were the ones working on the health project. They were making sure, looking when the appointments were available. And at the same time, the other team were looking at the restaurants, getting the names, because we learned that restaurant workers were considered first responders. So we need their names, their information, to make an appointment as soon as the appointments were available. So someone, I don't know if it was Diana, maybe it was Diana, who found like they recently opened a center in Brooklyn. So let's take all of them. So we rented the bus, we filled the bus, and we went with them to translate because it was scary for them. Language access, even though the city has doing an amazing in that part, but it's not enough, still not enough. And if we talk about language access, we have to mention indigenous languages, because many of our community members were not Spanish speakers as their first language. They speak Quechua, Quiche, Nahuatl, and many other languages. So we start translating all that information that we were provided by the health and hospitals. But our community were not really getting into reading it, because once maybe they don't know how to read and write in Spanish, and then they speak different languages. So the information at Mixteca is translated in 7 different indigenous languages. And we were like, we are doing better, but now we are getting asylum seekers that they have different other languages from Africa. So we are getting people from the community to translate the services. People trust us, and people believe Mixteca is their home away from home. And that's exactly what we want. We know how to develop those programs, whether it's mental health and addressing immigration trauma, because we know the mental health affects the body and all these complex situations that they have to face. So we create chocolate making workshops to address issues related to depression or to immigration trauma. Or we do some tortillas workshop that also are really cool to address nutrition and health eating habits in our community. Or many others that we have sip and paint, and we call sip cafecito and paint, because we cannot give alcohol, but this is the way that Mixteca addresses those issues. This is the way we open our center for the people to provide services with dignity and with respect, with all the care that us as immigrants deserve when we wish we got when we got here. But we are there for them, and every person that works at Mixteca can testify, can be a testimony of the way that they work. recently, because of the number of people we got at Mixteca, we have to leave 2 days for the follow-ups because our door, once our door opens, it's full of people lining outside to receive services. We are not a welcoming center. We are not a navigation center. We are a navigation center. But the problem is once we open the door, the request of services is overwhelming. So we decide to close the office 2 days to do follow-ups. Not to close the office for the people, but to do follow-ups. And I had to be telling my team, please don't provide services through the intercom, because that's the way they do it. It's like they feel so into the job, so passionate, that is no way for us to close the door for the people that are requesting services at the moment. So many things were in this speech, as always, and many of them, they're going to be there, but I won't stop before I said thank you to all our partners, to Almors to partner with us for the services, to Health and Hospitals to partner with us, to NYC Care that really have opened the doors for our community, because for the first time in their lives of many of them, they feel that they have an insurance to go if they need it, and not only for emergencies, but also to do some preventive care, which is really important, and it's even less expensive if we do this part. And I won't leave this place without thank NYU Langone and all their team there for their support in Sunset Park, and now it's the crying part. And let me, I'm not copying you. It comes natural, even I don't want it, and I'm like, oh, now it's fine, now I didn't do it. So, okay. So, just breathe and do it. Okay. Crying? Yes, I can do it. Yeah, we're going to thank the partners, the elected officials that have been supporting our work. And maybe I can't, but but I want to say thank you, because we feel seen and we feel acknowledged by the work we do. And and the reality is nothing that we do at Mixteca, we do it alone. We do it with all of you, and we deeply thank you for, we are an organization so local in one place of Sunset Park, but we provide these services with dignity and respect, and we never care about awards. We care about money. So because we need the money to do the services. We need the money to do the services, but this feels so good, especially especially after I hear who's getting these awards. I was thinking like this is important, but when I see Helen here, when I see you here, really powerful people, I feel so honored, and I win the crying prize. Thank you, everyone.
So Lori and I have been sitting here crying also. That's what we're doing tonight. What an evening. I've been to, as I said, 8 Tisch Health Prizes. This is an extraordinary outpouring of love and respect, and to hear these stories has enriched us, I think. Thank you again to Lori and Rick and to the jury, to Jonathan and all, and Helen and Lorena and Ted for unforgettable evenings. Before we go off to our reception, And I want all the winners to stay back for one more all group photo. I forgot to mention, and this is as appropriate a time as any, that upstairs we have installed some of the exhibition materials that we put out, I don't know, I can't tell time anymore from the last 5 years, but some time ago, to celebrate the Healing Walls effort of Lori Tisch and Rick's book. We put up some of these New Deal murals, copies of the New Deal murals that were stimulated by the Roosevelt administration, and which inspired the work that Lori did in mural making all across the city. So have a look at some of those old ones that continue to inspire us, as do all of you. Please join us for a reception upstairs.